It is a frightening statistic. Every 7 minutes, someone in Canada dies from heart disease or a stroke. Cardiac surgeons like Gideon Cohen are doing all they can to reduce the number of deaths, performing 20 operations a month on average. As part of a special series with Toronto's Sunnybrook Hospital, we went behind the scenes with Dr. Cohen to watch him in the workplace and away from it. In tonight's encore presentation from our series, Public Health, Private Lives, Dr. Cohen leads us right into the operating theater.
Percentage of childcare, I'd say it's about 50-50. I do half the work, Meg does half the work. Isn't that right, Meg?
I don't even know how to respond to this. Kid gets up in the morning and asks, how many times did the baby get up? Did she get up at all? Yes, good. She got up 8 times
Oh,
last
Meg, if I'm conditioned not to hear stuff like that. My pager goes off, I hear it though.
Right.
That's the good news.
Obviously, patients are always a priority, and sometimes your family takes a back seat. It's not easy. All right.
Yeah.
Mitral's okay?
I had to have minor surgery years ago, and I was a basket case. I was really nervous, and I was going for like a hernia, like it's a 20-minute operation.
He's very healthy, no plaque. She's got a great looking heart.
You know, I wouldn't let him put me to sleep because I was afraid of the general anesthetic, so they did it under local anesthetic. Most surgeons are like that, are probably sucks when it comes to surgery, probably because we know too much.
I'm 1700.
So I'm just going to go speak to my next patient, who is a young gentleman who has an abnormal heart valve that he was born with. And now it's putting a significant strain on his heart. So we're going to replace it with an artificial valve. Paul, you're having your surgery tomorrow.
Yeah, I hope so.
Okay. And you've chosen which type of valve?
A mechanical valve.
A mechanical valve, okay. Your heart, because of the valve problem, your heart has started to show signs of decompensation. We don't want to leave this for too long because right now, those changes in the heart are reversible. If you leave them for too long, they will eventually become irreversible. And we don't want that to happen. We want you to live a nice, long, healthy lifestyle. Any questions at all? Concerns? Okay. All right.
Lots of concerns, I'm sure, but...
Yeah, he'll be fine. We'll take good care of him.
I just can't imagine what he's going through. Open heart surgery is not common for young adults, and obviously this is the most stressful experience that he's had to go through in his lifetime. I am on my way home, just leaving the hospital.
All right.
Oh, you're silly. I don't think men kind of understand that when you're at home, he thinks I'm on a year of vacation, but it's a long day to be one-on-one with the baby.
Daddy's home. Hi. Hey, did you miss me? I missed you. You go for a run? So you have to babysit?
It's not babysitting when it's your own child, Gid.
I guess not. You know, we just had Addison, and Meg's already talking about having another baby. And it's like, man, I'm still recovering. You know, so.
Addie. It is not my first time.
Lesson, pause, of pause.
In heart surgery especially, you know, every move you make can be associated with a major complication. And a patient's life is on the line. I mean, you're stopping a patient's heart here.
I do have flashes of, I won't call it panic, but flashes of fairly extreme nervousness. Why do you?
Hi, good morning. How are you? I'm going to take him up to the OR. So follow me.
He's close to my age, and
I often think to myself what I would be going through if I had to have this operation done, and I wouldn't be faring well. I try not to think about things. The less you think about it, the less you worry. So Paul was just taken to the operating theater a bit sooner than we had anticipated because his blood pressure was lower than normal. But he's doing fine, and once they're set up, then we'll go ahead and start the operation. Here goes Paul. So Paul's our perfusionist from Newfoundland.
Nova Scotia.
Sorry, Nova Scotia.
Sometimes they call me the Maritimer, or for some reason, Dr. Cohen likes to call me the Noof. I'm not from Newfoundland.
What has your
Did quit smoking? Yeah. He quit smoking, which I never thought was possible.
There are times when we'll have a little bit of fun. We'll talk back to each other. It's our way of de-stressing in a stressful environment. Thank you, Dr. Cohen. It would be my pleasure.
My pleasure. He's going to wash my car after as well. It's part of the deal.
Starting off at 5'6".
Eyes a buys a builds a boat. Eyes a buys a sails her.
Oh, what a rendition.
So what have you taken up instead of smoking?
Stealing surgeons' cars.
Gideon's not the type of surgeon that ever loses his cool.
So I just watch your pressure here for a sec. He's having some arrhythmias. People ask me, how do you withstand that kind of stress? And when I'm in the operating room, I'm not stressed at all. Can we turn the radio on there? Break the monotony.
If you want me to sing anything by Blue Rodeo, I can do that. I just need the band to actually come and back me up.
Yeah. See you in a bit. One down, one to go. Oh, hey guys, how are you? Hey, how are you? Everything's fine. Went wonderfully. Everything's perfect, yeah. Went great, okay? Perfect. Did wonderfully, yeah. Oh, hey. I'm just an ordinary guy who happens to be a heart surgeon. I do the same thing as everybody else does, walk my dog in the morning, try and please my wife as much as possible. So now we're going up to the regular nursing floor. We'll go have a look at my patients that are still up there. Mr. Hung?
Oh, hi.
How you doing?
Right, Mr. Cohen.
Okay. And how's the food?
The food is excellent here.
Don't lie, it stinks. Right?
Yeah. No, I wouldn't lie to you.
I know. I'm just teasing you. Okay.
You really saved my life.
Very pleased.
I really appreciate it.
Our pleasure.
Thank you very much.
Okay, my friend.
And thank you.
I think that for the most part, physicians and surgeons in Canada are underappreciated, because there's no question that the grass may be greener at, south of the border. But most physicians and surgeons are in Canada because they love the healthcare system. They're certainly not here for the money. The average American surgeon performs maybe 80 heart operations a year, whereas the average Canadian heart surgeon performs about 200 to 250 cases a year. So, who would you rather have your heart surgery done by?
Going through my second double bypass.
After you step through this door, everything gets bad.
He had his initial operation in another hospital, and unfortunately one of the bypasses failed. So he's had recurrent chest discomfort.
Stress pain is unbelievable. The other doctor told me that I can't help you. He said, I'm not going to touch you because you're at risk. So now I'm thinking, well, you're just going to let me die?
Because he's young, he's only 46 years old, we've elected to kind of try and give him another chance and see if we can fix that one bypass that failed.
He's terrified. He's really afraid this time.
This is a high risk. This is a second-time operation. The heart has to be carved out of the scar tissue. And that's a bit risky because obviously there's a risk of injuring the heart and a risk of injuring the previous bypasses. So you have to be very cautious on entering the chest. There are certain times that are more stressful than others.
Does the EKG look close?
It's not the physical because, I mean, granted, I've been standing all day, but I think I am completely exhausted because of the subconscious stress that I don't feel. I'll tell you that when I get home, I'm wiped. When I get home, I'm wiped. Thanks, everybody. Hi there. How are you? Dr. Cohen. Nice to meet you. The first 12 to 24 hours after the operation is still the critical period. And that's why we'll keep him in the intensive care unit to keep a close eye on him. They're not out of the woods until, you know, they're awake and sitting up. And as far as I'm concerned, they're not out of the woods till they're at home. So, you know, you keep worrying about them every day they're in hospital. You have to worry because that ensures that you're always doing a good job.
I can tell when he comes home at night if he's thinking about a patient because his mind is elsewhere. I sometimes feel like going over to the patients who are complaining and saying, he does have a 3-month-old daughter at home that he hasn't seen in 2 days because he's been here all the time. So it's tough.
You going to bed now?
Yes.
Daddy just got home.
We stayed up to see you. He often will come home and he'll say hi and then he'll say, I just have to go check on the patient one more time before I go to bed.
I want to stay up and watch TV with Daddy. Right?
If Daddy wants to keep you up, he can also stay home tomorrow and deal with the cranky pants.
Just a bit longer.
10 minutes. You've got 10 minutes.
Hi, sweetie pie. A lot of surgeons are married to their profession. Why that contributes to high divorce rates, I don't know. Did you go to music class today?
To be married and to have kids, it's very stressful on the rest of your family. So I'm not surprised that there's a lot of divorce, but it happens.
So we'll go see James, who had his operation yesterday. See how he's doing in the ICU. How you doing?
Painful. But it's all right.
Everything went great yesterday. Okay?
Thank you very much.
All right, pal. We'll see you later.
You came to the right guy, I'll tell you that.
All right. Seeing patients after a successful operation, I mean, you know, there's nothing like that. Just gonna take this down and have a quick look. Okay. Good. Looks good.
You're all right at that, huh?
Try our best. It's a glorified seamstress.
Yeah?
The saving the life part, you try not to think about it too much because it'll give you a big head. People ask me and I tell them we're glorified auto mechanics, you know, there's a job at hand, we do it, we fix it and move on to the next patient.
Yeah, we're up.
You gotta be kidding. It's gotta be Paul's.
It's Dr. Cohen's favorite band, Blue Rodeo.
Mets, please? Gotta be
Well, it's
Paul's.
mine, for sure.
No, I actually like them too.
See, here it is, the best of Canadian healthcare, best Canadian band. Who could ask for more?
Thanks, everybody.
up.